So, in cancer care, I think one of the biggest issues in terms of caring for our patients are really the social determinants of health, so that our system isn't set up very well to take care of the non clinical aspects of their care. So, who's going to help them with transportation, to get back and forth from appointments, who's in their home to help them when symptoms develop, how are they going to manage those symptoms either from the treatment I'm giving them or from the cancer itself.
We have a lot of great problems. The biggest problem is we have not cured cancer yet, so we're going to try to get that fixed. I work in a couple different capacities. I am a scientist. We run a lab. We're trying to develop new therapies. We have one set of problems there, and then I'm a doctor. We take care of patients with cancer. In cancer, we're not trying to make the most effective medicine or the most safe medicine. We're trying to make the thing with the greatest ratio of efficacy to safety. So anything we had in the lab that would better model some of these novel platforms as we go forward, that would be a tremendous benefit. Since we don't have good surrogates for some of these things in the lab, we just need to be able to do clinical trials more quickly and effectively. The biggest hurdle probably to doing quick and effective clinical trials is getting patients enrolled onto clinical trials. Some of the biggest hurdles to getting patients quickly enrolled into clinical trials is patient awareness and doctor awareness of clinical trial availability.
So as an oncologist treating patients with many different kinds of cancer, I think our biggest challenge really is to facilitate communication. Patients really have difficulty getting through to their doctors and really communicating the things that are bothering them the most. So oftentimes, for example, I don't know what type of medications the patients may be taking. I may not be able to get through to them when I need to communicate something to them. So I think one of the technological advances we now have is that, of course, we can communicate with anyone, anytime, all the time. That's something that certainly young people and even older people are used to using now with social media and with cell phones and smartphones. I think the biggest challenge for us is how to facilitate this in a way that's not burdensome to the caregivers, the doctors, or nurses, but also to be able to communicate effectively with patients.
So at Mount Sinai I wear several hats, and one of them is the chief of the Division of Liver Diseases. I've been an active hepatologist or liver specialist for over 30 years, also attacking problems in the laboratory to try to understand better the basis for these diseases. Among the most frightening of liver diseases is primary liver cancer, also known as hepatocellular carcinoma. Amazingly, this disease is the second leading cause of cancer mortality worldwide. It has the fastest rising cancer incidence of any tumor that we see in the United States and Western Europe, and yet treatments are really limited and diagnostics are also very difficult. So this is a very difficult disease. The medical therapies are poor. The patients are sick. The diagnostics are simply lacking. We can't really provide personalized therapies based on any of the diagnostic tests that we currently use. So we're really hopeful for important solutions and new approaches that will help guide us to improve treatment for our patients.